We talk a lot about using AI and people using, ChatGPT and Google, which is getting better and better all the time. But it's interesting because I remember talking about this a week or so ago. There are people turning to it not just to look up, random information, but to deal with medical situations, right? You have a rash. You don't go to your doctor, probably because in this province you don't have a doctor. It's too hard to get an appointment or whatever. You look it up and there's an answer. And for whatever reason, we implicitly seem to trust these bots, these AI bots, to tell us what it is to do, put on a cream, put on whatever. Now what we're finding is, according to this new study from the Canadian Medical Association, this is kind of crazy, right? That 97% of responding doctors here say they have had to intervene to prevent harm or address consequences after a patient followed false or misleading health information online, including obviously from AI. Dr. Bolu Ogunyemi is president-elect of the Canadian Medical Association. He's on the line. Doctor, thanks so much for being here this afternoon. Look, I'd say, hi. I would say I wouldn't be too concerned if the number was, 40 or 50%. But when you see 97% of doctors saying, yeah, we've run into this before, clearly this is a problem.
For sure. Yeah, you're right. When you see numbers that high, something that's happened, that's happening in lots of different settings, right? So certainly that's something that I see in my practice in terms of, it goes both ways. There's some patients that are, really concerned when they put in their symptoms online and it says, oh, I have this serious disease or skin cancer. And then it goes the other way as well. There's some patients that, they can be falsely reassured, or they may delay useful proven treatments by trying some, unproven kind of treatment that they found online. So
I wonder, too, when you get a case like this, and obviously you had this happen, as I said here, most doctors say they've had this happen. I mean, what's the answer to someone, first of all, when they say, well, I went online and I asked ChatGPT what to do. You say one thing and ChatGPT said another.
It's tough. I mean, it's something that, is largely new, relatively, in terms of practice, because we do like that patients are, interested in their care and are empowered and can learn, in certain settings about their disease and so on. So it's good that patients have that, but certainly it's not always right, and it can be, a challenge to kind of fix some of the misinformation that patients have. But it's not the patient's fault. As you referenced, a lot of people don't have access to primary care and other forms of health and trusted information. We know that recent survey, again, by Canadian Medical Association, 87% of respondents said that not just a doctor, but their family doctor is the number one trusted source, but a lot of people don't have that access.
Right. I wonder, too, from what I read in the piece, it's very much a generational shift here, right? Obviously, younger generations, Gen Z, Gen X here, are the ones who already are used to, being online and getting these kinds of things. They're the ones that you see most who are getting this information and potentially not following through?
So the data shows, as you mentioned, a little bit more common in younger generations, but it is increasing to all demographics. People of all ages are having exposure to this health information. But you're right, just that younger folks just spend more time online, right? So the more time, the more things you're going to see that can be harmful. So I find it's all different demographics. I do agree. You're probably more common in folks that are under 40, but we do see it in lots of different settings.
So I guess my next question would be, how do you combat this, right? The number is not going to go up or not going to go down likely. It's likely to go up as more and more people feel comfortable going on AI. So what's your sort of comeback? What do you tell people?
Yeah, so there's lots. I mean, in our day-to-day practice, it can be difficult because you have to kind of dispel some of the myths, which we can do, especially when we have a rapport with the patient. But broadly, we need to think, on broad terms. So patients expect that the federal government, will act, in different levels of government, will act in reducing the harms that can be caused by finding information online. Patients are 4 to 5 times as likely to have a negative health outcome if they listen to AI than the patients that responded in a similar survey to the one you're referencing that didn't. So we need federal legislation, including an online harms bill, to be reintroduced. Health Canada, this would be under their purview in terms of health and safety of the population more broadly, and they do have an act that can enforce this. So those are two ways at the federal level that we can really reduce the impact of this.
What is this Healthcare for Real initiative that I read about from the CMA?
So the Healthcare for Real initiative is another approach. So the last two I talked about are ways to kind of prevent federal level to prevent this from happening as much. But it's also important to increase, useful, important sources of health information that are accessible. So Healthcare for Real is on social media, so folks can go to Canadian Medical Association, search Healthcare for Real, or Instagram and TikTok, and find credible and we think interesting, entertaining sources that can talk about what it's like just being in the healthcare system, how to navigate the healthcare system, and more credible answers to questions. And we do respond to things that people are searching, and also kind of respond to the replies and interact in that way. So that's a way to kind of meet people where they are. I mean, they're already on their phones, as you discussed, so we might as well put the proper information in front of them.
I wonder too if you wouldn't mind sharing, or maybe there is no consensus, but I mean, when I say people look up stuff, you've seen patients who have come to you, as so many other doctors say they have as well, describing what they found as a solution online. Is there a sort of common issue that people come to you with and say, hey, I saw this, is like one above anything else? It fluctuates, just like we know different kind of trends fluctuate. I think at one point there was a lot, that I see in dermatology about sunscreens being bad and people, avoiding sunscreens and the harms, related to that more broadly. That is kind of died down over the past little while. It does really kind of come in waves. I think a big area, the important area though, would be in terms of cancer and diagnosis and treatment, right? Because that affects many people, unfortunately. I will point out, I thought this was quite fascinating. One of the things, right? So people look up, you have a cold or something, you've been sick for a week, and you're thinking, well, it shouldn't take that long to be sick. You go online, and then online it would tell you, usually around a week, and then you wonder, wait a sec, how come you think you're a lot sicker than you are just because that guideline is not the one you happen to fall into?
It's tough, yeah, and some of it is confirmation bias, right? I mean, if you search on balance, when we search things, we'll see a lot of responses that'll confirm what we might already be thinking, and then the bias, of course, for humans is tend to discount whatever is going kind of against what you're thinking. So that plays into it a little bit as well. And like you said, searching online is just never the same as seeing someone in person, right? They can tell, someone that's seeing a lot of colds, as a lot of family doctors have, and emergency doctors will know, probably just by seeing you kind of whether this is a major problem or kind of something run-of-the-mill, but obviously not everyone can have that access.
Yeah, I'm wondering too, someone just texted saying, my daughter's oncologist told her to put her biopsy results into ChatGPT if she wanted to better understand them. Yeah, I mean, I think that is, there's a role for a lot of folks to play. One thing that I'm hoping that we can do, as a profession is really kind of meeting patients where they are. So kind of plain language, telling them, of course, they can have all the results that she has, but really interpreting what does this mean for the patient? What are the options? Yeah. What are the steps? What kind of stage this is compared to others? So the more we do that, and then the less someone will have to rely on ChatGPT, right? Fair enough.
Obviously, if she had access to someone that would give her, she'd probably prefer to see it in person. So we do need increase access to care.
Dr. Ogunyemi, I want to thank you for the time. Appreciate it. Thanks so much.
I'm Luke Wilson. Join me each week for Film Never Lies. Since retiring from the NFL, I've had a lot on my mind, and now I've got my own show. So if you're tired of lazy takes, if you want honest conversations, join us each week. Film Never Lies, available on all TSN platforms and the iHeartRadio app.